On this Thursday night, critical care in a deepening crisis. Canada's hospitals are running out of staff.
They're exhausted and are suffering from PTSD.
And rooms for patients. Canada's mission to help train Ukrainian civilians to battle Russian forces.
We have now entered a new and very dangerous phase of this conflict.
As we meet the doctors saving lives in this bombed-out Ukrainian hospital. The Russian prison punishment for American basketball star Brittney Griner.
I made an honest mistake.
And her fight for freedom. Plus, SOS at sea. The man trapped under a boat waiting 16 hours to be rescued.
Global National with Donna Friesen. Reporting tonight, Farah Nasser.
Good evening, and thank you for joining us. The situation at hospitals across the country appears to be getting worse by the day. Today, the president of Canada's largest nurses union called on the Prime Minister and the provincial governments to address the staffing shortage in our overburdened healthcare system.
Canadians across the country are feeling the negative impacts of government inaction and this piecemealing that they're trying to do to give care. All levels of government have a responsibility to ensure that Canadians have access to high-quality public health care.
Now, the problems plaguing our healthcare system were predicted and diagnosed years ago. But as Seán O'Shea explains in our top story tonight, the prognosis remains unclear.
In downtown Toronto, it isn't business as usual at one of the city's most important healthcare centres. Toronto General Hospital operating under a critical care bed alert, meaning there isn't room here for the most serious cases right now.
Be mindful, we don't have the staffing or capacity to accept them at this point in time.
Staff shortages in hospitals around the country are a growing problem with no simple solution.
Healthcare workers who are feeling overworked, burnt out, under-resourced. And we have to do something about it.
There aren't enough nurses, aren't enough support staff, and every week it's only getting worse.
They were not built to see the amount of pain, suffering, and deaths that they have seen.
Ontario's Nurses Union says that province alone needs 30,000 more nurses.
Can we do better? We can always strive to do better. Can the hospitals do better? 100% they can do better.
But hospitals say they can't find enough qualified nurses quickly enough or help foreign trained nurses meet Canadian standards. So health networks are rethinking how they use what little remaining staff they have.
How do we take people with narrower scopes or narrower skill sets and use them to really support our nursing and physician colleagues in particular?
The healthcare crunch doesn't just affect those needing urgent care now. In many places, trying to find a family doctor is more difficult than ever.
We've been on the waiting list for, close to a year, and it's been really hard for us to find one.
This family with a 2-year-old and a newborn who'll need a regular medical procedure just got a doctor.
If it was easier to get a family doctor, that would be great.
We're throwing everything we possibly can.
I'm doing a lot of listening, a lot of learning, finding out where the challenges are, where the opportunities are.
The most serious challenges are in emergency departments and intensive care units.
Wait times have ballooned to 20 hours. Many have had to close their emergency departments and ICU beds, and life-saving surgeries and treatments like chemotherapy continue to be put on hold.
Adding even more backlog to the system and its frontline workers and the patients who can't afford to wait. Seán O'Shea, Global News, Toronto.
In BC's southern interior, another batch of homes have been placed under evacuation order. It's due to the still-growing Kharkiv Creek wildfire. Helicopters are dumping water on the fire, and ground crews are working around the clock to protect homes in the southern Okanagan. Fire officials say the Kharkiv Creek blaze has nearly doubled in size since it was last mapped, but much of that growth is due to controlled burns designated to stop its spread. Despite the arrival of cooler weather, there are more than 60 active wildfires burning around the province, and British Columbians are being told to expect the extreme fire danger to persist for at least several more weeks. An investigation is underway in Montreal tonight after police shot and killed a man suspected in 3 homicides. The shooting happened this morning outside a motel. Investigators believe the suspect was involved in 3 seemingly random shootings in Montreal and Laval over the past 48 hours. 2 men were killed in separate shootings on Tuesday night, and a 3rd man was shot and killed in Laval last night. Police think the 26-year-old suspect acted alone.
Such events cannot be tolerated. Indeed, Montrealers should
feel safe to walk in each neighborhood at all time in all places.
Quebec's provincial police will take over the investigation into the 3 fatal shootings, while the province's police watchdog is looking into the suspect's death. A retired Supreme Court judge will lead an independent review into Hockey Canada. Thomas Cromwell is going to investigate Hockey Canada's use of its National Equity Fund to settle sexual claims, as well as the organization's governance structure and systems. The review was announced last month after news broke members of the 2018 World Junior team were accused of a group sexual assault, and Hockey Canada reached a settlement with the complainant. Canada is sending members of the military to the United Kingdom to help train Ukrainians to fight for 4 months. They'll teach civilians how to use weapons, how to administer first aid, and military law. And as Mercedes Stephenson reports, it's not the only new mission Canada is involved with.
As Canada officially and publicly announces it is getting back into the business of training Ukrainians to fight, there is a much more secretive mission Canada is involved in on the ground. Multiple sources say elite Canadian operators from the Canadian Special Operations Command are working in the shadows to help train Ukrainian troops and facilitate weapons and equipment delivery. The Minister of National Defence did not deny the reports, but was tight-lipped.
It would be imprudent for me to provide that information.
Today, the minister announced 225 Canadian military personnel will deploy to the United Kingdom, working with the British Army to turn Ukrainian civilians who have signed up to fight Russia into soldiers. It is the relaunch of Operation Unifier, the mission to train Ukrainian troops originally in Ukraine, that was suspended just before Russia attacked.
We are fulfilling our promise to resume large-scale training under Operation Unifier.
Canadian troops will start training their Ukrainian recruits with the basics, everything from frontline fighting skills to patrolling, weapons handling, and first aid. Imparting basic skills and generating new recruits is critical because of the type of war Ukraine finds itself in.
The Ukrainians are in a war of attrition with the Russians, and they are sustaining very high casualties.
Training troops is something Canada is particularly skilled at.
These are something that Canada has particular expertise in, both within NATO and sort of around Western allied countries.
The past training from Operation Unifier and similar allied programs have proven worth their weight in gold in terms of the skills and professionalism imparted to Ukrainian soldiers, which took the Russian military by surprise. The first contingent of Canadian troops will come from 3rd Battalion of Princess Patricia's Canadian Light Infantry, based in Edmonton, and will deploy next week. Canadians have also been training Ukrainians already on how to use those M777 howitzer guns that Canada has sent over. Farah?
Mercedes Stephenson in Ottawa. Thank you, Mercedes. Opposition MPs grilled ministers at a parliamentary committee who defended their decision to relax Russian sanctions and export gas turbine parts repaired in Montreal. Last month, the government defended that as necessary to get gas to Europeans. But Russia's Gazprom continues to stall and reduce gas flow, blaming a lack of documents from Western nations. And the Canadian government now says the decision was all about calling Putin's bluff.
At the time you made this decision, was there any discussion of calling Mr. Putin's bluff at the time of the decision?
Absolutely. And certainly I discussed that with Minister Habeck, who is the German energy minister.
We urge you, do not take the bait. There was no need to waive the sanctions to call Putin's regime bluff and simply liar.
Ukrainian, German, and European Union ambassadors to Canada testified, as well as the Ukrainian-Canadian Congress, which urged the government to revoke the permits. What had been a sprawling medical complex in peacetime Ukraine has now been reduced to a single damaged building near the front line due to danger from snipers. The few doctors still on duty have to avoid the operating room, and the generator that they rely on for power is so loud that they often can't tell how close the bombs are falling. Our Europe Bureau Chief Goomansingh was granted special access to see firsthand how medical teams there are enduring.
The morgue, a dental facility, a sterilization building, and therapeutics clinic, all gone. Neurologist Ilona Butova says of the 27 doctors who worked here before the war, 5 remain. There were such cases when civilians were brought in with great damage. There was heavy shelling, and we provided help in the corridor. Her reality is so different from her dreams. This neurologist scrolling through her phone to show me the application she started a few years back to move to Canada to practice medicine. Hospital staff have requested we not name the town it's located in. Both soldiers and civilians are treated here. The hospital is dark, the hallways small, and there's little equipment to be seen. This is the hospital's bomb shelter, and it's only really used by the doctors when it's absolutely necessary, when the shelling is very, very close and very loud. It's not the most comfortable place for doctors or patients, but they've actually operated on someone down here. Shrapnel was pulled from a patient while in the bunker. Cell phone video was taken of the operation. Phones were also used to provide the doctors with some light to work. Above ground on the top floor, it's the opposite problem. This room doesn't get used. The windows and all the natural light, she explains, make the staff vulnerable to sniper fire. The injuries seen here are critical, and the volume of patients can be overwhelming. 10 wounded soldiers can arrive at once, all in dire need of urgent care. Medical personnel from Kyiv are now helping on site. Our hospitals are not very well equipped. We bring a lot with us, and volunteers help us. Around town, you don't see many children or open businesses, just fortified bunkers, open fields, and destruction. The hospital complex has been shelled at least 5 times since February 24th. I have 2 daughters, 5 and 10, and when it was dangerous here, I put them on an evacuation bus. Separated from family and overworked, the war has been unrelenting for these doctors who say everything they do is in service of their country. The hospital has become home, their work consuming every minute of their day. Though Global News did witness a tiny reprieve. A little care for the caregiver with a surprise visit from Butova's husband. She hasn't seen him in months. Crystal Goomansingh, Global News, Northern Kharkiv region.
What a powerful hug. A Russian judge has convicted WNBA superstar Brittney Griner of possession and drug smuggling.
I made an honest mistake, and I hope that in your ruling that it doesn't end my life here.
Despite apologizing and asking for leniency, the judge sentenced her to 9 years. Griner has already spent more than 5 months in prison after less than a gram of cannabis oil was found in her luggage while she was trying to fly out of Russia. Her defense team says it is going to file an appeal.
We feel disappointment. You know, when we saw Brittney, I think it was Tuesday, and we told her, see you on Thursday, and she said, see you on Doomsday. So looks like she was right.
It's hoped Griner's sentencing could now pave the way for a U.S.-Russia prisoner swap that would include her and an imprisoned Russian who was once a prolific arms dealer. China is fired up. Coming up, the ballistic missiles it's launched near Taiwan. Tensions keep rising in Asia after U.S. House Speaker Nancy Pelosi's visit to Taiwan. Its president is condemning China for conducting its largest ever military drills around the small nation, including the launch of ballistic missiles. The Chinese military, though, is calling the operation a deterrent to collusion between the U.S. and Taiwan, which, of course, Beijing regards as its own. Redmond Shannon reports.
China's biggest ever show of force in the Taiwan Strait. Footage from Chinese state TV claims to show the military exercises, which Taiwan says included 11 ballistic missiles fired into the sea. The drills were conducted in 6 areas surrounding Taiwan, 3 of which overlap the island's territorial waters, much closer than during a similar flare-up in the mid-90s. Beijing says the exercises are a legitimate defense of what China regards as its own territory. China's foreign ministry described Nancy Pelosi's visit to the island this week as manic, calling the US House Speaker's presence a violation of the American One China policy, under which the US operates a so-called strategic ambiguity on Taiwan's status.
And I want to emphasize, nothing has changed about our position. And I hope very much that Beijing will not manufacture a crisis or seek a pretext to increase its aggressive military activity.
Taiwan's President Tsai Ing-wen called the drills an irresponsible violation of the democratic island's sovereignty. She said she doesn't want an escalation, but that combat readiness has been increased. It's likely the US would have factored in the Chinese reaction to Pelosi's visit, betting that a full invasion of Taiwan remains unlikely, even though Chinese President Xi has never ruled out such a move.
In autumn this year, Xi Jinping is going to most likely have his third term approved. It means that they really believe, I suppose, that they can't show any sign of weakness.
Japan also condemned the operation, claiming 5 missiles landed into its waters. The drills are scheduled to run until Sunday. Redmond Shannon, Global News, London.
Judgment Day for Alex Jones. Ahead, the legal reckoning for one of America's most notorious conspiracy theorists. Some breaking news to tell you about. A U.S. jury has decided right-wing conspiracy theorist and InfoWars host Alex Jones will have to pay the parents of a child killed in the Sandy Hook massacre $4 million. Now, this comes after Jones was found liable for defamation earlier this year for repeatedly calling the mass shooting a hoax and describing the dead children and their grieving parents as crisis actors. As Jackson Prosco reports, the ruling could be just the start of Jones's legal problems.
Alex Jones spent years peddling harmful conspiracy theories.
The whole thing is a giant hoax.
And profiting from them, telling his millions of followers that the massacre of 20 elementary school students never happened.
Sandy Hook is a synthetic, completely fake, with actors.
For that, he faced a defamation suit brought by the parents of Jesse Lewis, a grade 1 student who died at Sandy Hook Elementary. They say Jones made their lives and their loss a living hell.
My home was shot up. Vehicles were shot up in my yard.
I don't think that you understand the repercussions of going on air with a huge audience and lying.
As the trial wore on, Jones kept up his on-air attacks on the families, even as he finally relented in court.
It's 100% real. I think Sandy Hook happened. I think it's a terrible event.
The stunning reversal came in a trial full of surprises. With accusations, Jones withheld key evidence and lied under oath. That came to light after a mistake by his own lawyers.
Your attorneys messed up and sent me an entire digital copy of your entire cell phone with every text message you've sent for the past 2 years. And that is how I know you lied to me when you said you didn't have text messages about Sandy Hook.
After the accidental release of data, Jones asked for a mistrial, but was denied. Now there's a rush to access the contents of his phone. Jones's lawyer admits that includes intimate text messages with Roger Stone, a close ally of former President Donald Trump and a central figure in the January 6th attack on the U.S. Capitol. It all suggests the Sandy Hook suit could be the beginning of something bigger, as one of the loudest voices on the American right risks being brought down by his own words. Jackson Prosco, Global News, Washington.
4 Louisville, Kentucky police officers involved in the shooting death of Breonna Taylor have now been charged with several crimes, including civil rights violations. The former officers and police sergeant are facing charges that include lying to obtain a search warrant for Taylor's home. The U.S. Attorney General says federal officials share but cannot fully imagine the grief felt by her family. Taylor, a 26-year-old black woman, was shot to death by officers during a botched raid in March of 2020. Survival at sea. How long did this boat's 62-year-old sailor languish in frigid waters? A French sailor was faced with a life-threatening situation when his racing boat capsized in the Atlantic off the coast of Spain. He spent 16 hours trapped in his overturned boat before search and rescue crews arrived at the scene for what became a difficult and dangerous rescue operation. Ross Lord has the harrowing details.
Accidents at sea often turn tragic, but this story is a breath of fresh air. A French sailor whose high-tech racing sailboat capsized survived. The 62-year-old sailor waited for 16 hours for the Spanish Coast Guard to rescue him. In frigid water temperatures estimated at 16 degrees Celsius, survival experts say he'd likely have lost consciousness and drowned if not for his neoprene survival suit that added an extra layer of crucial insulation. And this special sailboat, designed to be unsinkable and designed to float high on the waves when overturned.
He was able to stay dry from the knees up. Water conducts heat away from your body 25 times as quickly as air does. So once you're immersed, the clock is ticking.
On Monday night, the 12-meter boat sent out a distress signal off the Galicia region of northern Spain. After confirming signs of life, Coast Guard officials decided the sea was too rough to attempt a rescue. Instead, divers waited until morning, keeping the boat in place by attaching 5-ton balloons, an operation they say verged on the impossible.
He would have still felt the motion of the vessel. It's still a very almost terrifying situation. Let's say this boat get hit by a big wave or a rogue wave. If it went over on the side, it could have went down.
And the sailor might have gone down with it. For the rescue, 2 divers swam under the boat and freed the sailor. Incredibly, he had enough strength remaining to start swimming to safety. He was airlifted to hospital, finally free from an ordeal that stretched on for hours before its inspirational ending. Ross Lord, Global News.
And that's Global National for this Thursday night. I'm Farah Nasser. On behalf of our whole Global National team, I want to thank you so much for spending part of your evening with us. Tonight's Your Canada is Cape Bonavista Lighthouse in Bonavista, Newfoundland and Labrador. Until tomorrow, take care of yourselves and each other. Good night.